Good afternoon. Thank you for the opportunity to be here and talk to you today. David mentioned that he had the challenge of talking to you right after lunch. I think I have an even bigger challenge talking right after him. But I'm going to talk to you a little bit about what I've been working on for the last year, and that is setting up a brand new GSD program and initiating a protocol for starting glyphosate to treat blood sugars overnight in patients with GSD. Okay, so our objectives for today are to describe the experiences of one center, that's the Cleveland Clinic, in setting up an inpatient protocol for the initiation of glyphosate for overnight management of blood sugars in patients who have GSD. To review the procedure for patient selection, dosing, and monitoring during both admission and then follow-up once they go home. And we'll talk about some patient experiences and outcomes using some case study examples. Our anticipated outcomes for today are to gain an understanding of how to develop an inpatient protocol for the initiation of glyphosate, and also to develop practical strategies for patient selection, dosing, monitoring, and follow-up. I'll tell you a little bit about myself. I went to a small all-women's college just outside of Cleveland, Ohio, called Notre Dame College. And then I went to Toledo, Ohio, where I went to medical school at what was previously called Medical College of Ohio and then merged with the University of Toledo. I went to South Carolina for my pediatric residency at the University of South Carolina. And then started my first year of fellowship at the Medical University of South Carolina in Charleston, South Carolina. Found out at the end of my first year that my program was voluntarily closing, which was a big surprise, completely unexpected. And I didn't know it at the time, but it was also the greatest opportunity of my entire life because that's how I ended up in Florida and met Dr. Weinstein and became involved with GSD. So I completed my fellowship at the University of Florida. That was just about a year ago. And then I moved back home to Cleveland. So now I'm at the Cleveland Clinic, Cleveland Clinic Children's, we're calling ourselves now. And I went there with the goal of building a GSD program. From the time I started interviewing there, I was very honest with everybody about this is what I wanted to do. And I've really been met with tremendous support. So the program launched in December 2012, so we're still in our first year. So far, we've had 35 patients, give or take, come to see us from about 12 different states. We have done glyphosate trials in 17 of our patients, and the results have been almost uniformly positive. So of course, with building a new program, there's many challenges that we faced, but also many opportunities. So to tell you a little bit about the challenges, obviously, to start something brand new, this was a patient population that nobody had any experience with. And so there was a lot of apprehension, especially with this condition in particular, where if you only know about it, what you've read in a textbook, it can be very scary. So that was probably one of the biggest challenges that we faced, just getting everybody comfortable with what we were doing. Logistics, of course, was another big issue. So we had to figure out how exactly are we going to take care of these patients. The program is primarily an inpatient program. So where were we going to admit them? Who is going to be the team of people that were involved in the care of these patients? How were we actually going to collect the data that we needed to do what we wanted to do? And so what we ended up settling on is our patients came to the intensive care unit. And of course, they're not sick when they come. They come in for routine monitoring. We assess their metabolic control and we titrate their therapy. But we do it in the intensive care unit because we base our decisions on labs that are obtained hourly. And so only in an ICU setting do you have the nursing support to be able to do that. So patients in our PICU never have more than 2 patients, whereas on the floors, the nurses might have a whole lot more than that. So I've had a lot of opportunities at the Cleveland Clinic in building this program. There's a really strong team of people that have helped me to be able to take care of these patients. So before I came to the clinic, there was one pediatric gastroenterologist who's wonderful, and he's the one who took care of all the patients with GSD in the area that were coming to the clinic for their care. So he's been very involved with the program. There's two geneticists in particular with an interest in GSD, and so they've been involved with my patients and have been very helpful in many cases, and sometimes getting a genetic diagnosis if we didn't have that yet, or providing genetic counseling. The intensivists are a very important part of our team because we do admit these patients to the intensive care unit, so I co-manage the patients with them, and they're always in-house. And then I'm especially impressed with our dietitian. So I work very closely with Carrie Gonzalez. Some of you may know her. She's absolutely fantastic. She's incredibly smart, and she has grown to love GSD. So she's been involved with virtually every patient that has come through the program, and I'm so lucky to work with her. Also, so the nurses have been very interested in learning about GSD, and that's important because they're the ones who are on their front lines. So they probably spend more time at the patient's bedside than anyone else, and so their comfort level is very important. Early on, as patients started to come through, they would ask me to come talk to them at shift change. So I would be there every day at 7 in the morning, 7 in the evening to talk to as many nurses as I possibly could. They invited me to speak at an annual PICU Nurses Education Day. So they're really very interested in learning more about this. And their comfort level has grown tremendously as well. Okay, so once we have the patients in the hospital, how do we go about figuring out who's appropriate for glycosade, and how do we dose it, how do we monitor it and follow up? So even though it's a miracle product for many people, it's not right for absolutely everyone. So at Cleveland Clinic, I've only used glycosade in patients over 5 years old. That's the approved indication. But patients with all types of GSD could potentially benefit. So anybody who requires a dose of cornstarch in the middle of the night, is waking up to take it, could benefit from taking glycosade at bedtime. At the clinic, I've tried it in patients with types 1A and B, type 3 and type 0. So I give a dose at bedtime. And of course, the dose that's given at bedtime of glycosade is often bigger than the dose of Argo that they would take. And so if they're on smaller doses, then just like David said, I would add those doses together to give them the same amount of cornstarch to cover the same amount of time, except this time they don't have to wake up in the middle of the night for it. Adults, I'll often start with 135 grams and just see how they do on that. So I monitor blood sugar hourly, and then either lactate or ketones, depending on which type of GSD that they have. And in some cases, what I'll do is schedule a dose of Argo cornstarch to be given 8 hours after they got their glycosade. With patients, in particular with type 1, who are on Q4-hour dosing during the day, if they were able to get an 8-hour stretch at night, then it would be really easy to keep up with that Q4-hour schedule during the day. So I might schedule a dose of Argo 8 hours later, hope that the glycosade lasts 8 hours, and then it could all work out very nicely. But what I've done in other cases is not scheduled a dose of Argo and just used the monitoring to see how long does glycosade last in this person. And in some cases, it's been quite a bit longer than 8 hours. So even if we figure out the dose that works well for them in the hospital, there's a lot of other factors that could cause some problems when they're home, when they're in their own environment. So things like their activity level, food that they're eating at home that might be different, environmental factors, stress. All of these things you can't always account for in a hospital setting. And so once they go home, I ask them to measure blood sugar and either lactate or ketones before every dose of cornstarch for at least 3 days. And then after that, maybe once a week, I would ask them to monitor, and certainly anytime they're sick. But that home monitoring is very important to know that this is really going to work for them. Okay, so the patients who have tried glycosade in our program, there's been 17 total. 10 of them have type 1A. 4 have type 3A. There's 2 patients with type 1B and 1 with type 0. 11 of those 17 completed a trial as an inpatient. And there was a number of reasons that some people did not complete as an inpatient. One of my patients was a 4-year-old who turned 5 several months later. So we waited till after his 5th birthday to try it. And it was a patient from out of town. So they did that at home. I had 2 sisters who came to see me, and they had never seen a doctor. They had never seen really a GSD doctor before. So it was kind of their first visit. We were just establishing a routine in them for the first time. And so I wanted to use Argo cornstarch and protein. They had type 3. And they were only able to stay with me one night because of work obligations. So I would have liked to keep them for a second night and try glycosade in-house. But they left. They tried it at home and never followed up with me to let me know how they did. So I actually have data for 15 of those patients. And then in my program, in the PICU, I'm able to admit patients who are up to 26 years old, but I do take care of patients older than that, and I see them on an outpatient basis. So I had 3 patients who are over that 26-year age limit, and so they did a trial at home. So, as I said, I have data for 15 of the 17 patients who have tried glycosade. And 11 out of those 15 lasted at least 8 hours after a single dose of glycosade given at bedtime, and even up to 12 and a half hours. There was 2 additional patients who lasted 7 hours, and I think probably most of the people in this room would consider 7 hours a full night of sleep. So that's 13 out of 15 patients who were able to get a full night of sleep with 1 dose of glycosade. There was another patient, one of my older patients, who did a trial at home. And 4 hours after he took glycosade, his blood sugar was 82, which he got nervous about, thinking it was a low blood sugar, and he took Argo. So that wasn't an accurate trial, and we can't say the glycosade failed in that case. So then I did actually have 1 patient who did not do well on glycosade, and this is a patient who has been in chronic poor control. So his lactate levels were elevated at baseline. But what I saw in him was that 4 hours after he got glycosade, there was even further increase in his lactate concentration. So it went from 3.6 millimoles per liter up to 5.5. And then an hour after that, he became hypoglycemic. So that is the 1 patient in whom the glycosade trial truly failed. But his baseline control was abysmal, and I think that's probably a big part of why. So I wanted to talk to you about a couple of my kids, just to illustrate a few points. So I have a 12-year-old patient who has GSD type 1A, and she is in excellent metabolic control. She is absolutely perfect. She's healthy. She's active. So I had her overnight to try glycosade, and she was able to maintain normal blood sugar levels and normal lactate levels for 12 and a half hours. This is my patient who has gone the longest after 1 dose of glycosade. But like I said, she's a very healthy, active young girl, and when she was in the hospital with me, she stayed in bed pretty much the whole time. So I knew there was going to be a difference in her activity level once she went home and she was waking up in the morning, getting ready for school. And so that home monitoring really became crucial. And we did find that in her own environment, when she was more active, she was able to last 8 hours on glycosade. So that's still a success, but a big difference from the 12 and a half hours that we saw in the hospital. I have another patient who's 11 years old. He has GSD type 0. And so there's a lot of variation in what you see in patients with type 0. Some of them are milder, and some of them are a little bit more severe. They don't all require a dose of cornstarch in the middle of the night, but he did. He had to wake up every night and take cornstarch, or he would get low blood sugar and elevated ketones. He tried glyphosate a number of times in the past, and he just couldn't tolerate it. I think the volume was an issue for him, and he didn't like the taste. So every time he tried to drink it, he would vomit. Well, he made it 11 years without a G-tube, but he and his mom talked about it and decided that the best thing for them to do would be to get a G-tube so that they could use glyphosate and get a full night of sleep. And so that's what they did, and now they're routinely getting 9 hours of sleep every night. So a couple take-home points that I want to leave you with. So creating a center to treat patients with glycogen storage disease is challenging, but it's also been incredibly rewarding. And one of the most rewarding things that I can do is give a patient a full night of sleep when they've never had that before. And so with glyphosate, I'm able to do that, and it really has been life-changing. So thank you for your attention. Is there any questions?